Good afternoon. Thank you for joining us today. We've got a couple points of considerably good news. The first I just want to start off with, today we're only reporting 94 positive cases. You have to go back almost a full calendar year to have a day in which we were under 100 positive cases, and I think this is encouraging. We continue to see our case count, as we'll show in a minute, trending in a positive direction. The other is our vaccine numbers continue to be very high. With the addition of the DoD and VA numbers and everything we're doing, we remain one of the top counties in California. And so we're seeing considerable progress both in terms of cases, the much lower impact on our hospital system now, certainly than where we've ever been out of the recent year or so, along with progress around vaccines. And in that progress around vaccines, we fully expect and are highly confident that by late tonight, we will be in a position where the vaccine will be opened up for 12 to 15-year-olds. CDC appears to have finished their review. The Western States Working Group, that is comprised of public health officials from Nevada, Washington, Oregon, and California, are scheduled to meet this evening to review the FDA and CDC information, and we expect guidance to come out at some point tonight that would authorize a vaccine for 12 to 15-year-olds beginning as early as tomorrow morning. We won't officially know that until tonight, but it is our expectation that tomorrow morning 12 to 15-year-olds will be able to receive the vaccine. We will confirm that later this evening with all of you once the Western States Working Group completes their review and issues their official guidance. In terms of how folks will be able to access the vaccine, for 12 to 15-year-olds, it is the Pfizer vaccine is the only one in which they're eligible for. The good news is we have significant quantities of Pfizer vaccine on hand. We've been able to, as we've had lower demand than we've had supply, kind of prioritize Moderna and J&J, and are also getting increased shipments. And so we think we have a healthy amount of J&J vaccines that can serve that population of San Diegans, which we estimated 175,864. Again, 175,864 San Diego residents between the ages of 12 and 15. If you go on My Turn, once you enter the age of the person seeking to get a vaccine, it will only connect you with a Pfizer appointment, meaning an appointment at a location that has Pfizer vaccine. Additionally, all of our static locations or set locations will all have Pfizer vaccines available for drop-ins. So if you would like to make an appointment for your 12 to 15-year-old, you can do that, and that will ensure you get Pfizer, but you're also free to drop in at any of our set locations. The mobile sites that we're sharing that are mobile, that are moving around and temporary, those are primarily composed of J&J, but each of our set locations will have Pfizer available for drop-ins as well. And throughout the day, we will monitor the usage of those, and if we need to adjust and move Pfizer vaccines around, we can do that. But we believe we'll be able to meet the need of 12 to 15-year-olds in San Diego County via appointments and drop-in locations that are there. We will have a Q&A, which will be updated on our website as soon as the official guidance is given, that will walk folks through basic questions about you do need the consent of your parent or legal guardians in order to get vaccinated. Minors will have to show some proof of eligibility, just a birth certificate, a school ID, some form of ID to prove or show their age between 12 and 15. And so we'll have a Q&A that will be updated once the official guidance is out, and we expect that to happen this evening, and that will be on our website to answer any questions that folks may have surrounding 12 to 15-year-olds. The other encouraging trend I'll share with you in a little bit, we had a healthy supply of vaccines arrive this week. We are expecting more than 200,000 doses just into our system to be shipped next week. This will be a significant jump in the availability of vaccines. We're also encouraged that we think 2/3 of those will be Pfizer. So again, we will be in a strong position to meet the needs of 12 to 15-year-olds as we move forward. And we have plenty of vaccines available at this point. So we want to reiterate and encourage anyone, if you have not been vaccinated, please do. Our appointment system has been lengthened, so if you want to make an appointment, it's more convenient. You have a little more certainty about how long you'll be there. We're making it more convenient to make appointments. We also have drop-in at all of our locations. We have locations that are expanding hours, and we are increasing our mobile sites. I'll share with you in a minute a few of those. But last week, we launched a sign-up program where religious institutions, businesses, nonprofits, community groups that would like to have us bring a vaccine location into the community to them can apply for that. To date, we've received more than 60 submissions for vaccine events, and we're presently vetting those. We may not be able to fulfill every one of them, but we are looking for large-scale events where there's potentially hundreds of folks that could come in and get a vaccine. So our efforts around the vaccine, again, continue to shift to make it more convenient, make it easier to access, and we're very excited about the pending. Again, it won't be official until the Western States Working Group signs off tonight, which includes California Department of Public Health as a part of that group. But we are optimistically looking to the high probability that will happen this evening, and then we'll be able to open up vaccines to that population, 12 to 15, hopefully as early as tomorrow morning. With that, let's jump into our slides. Here again, you just see the progress we're making towards that initial goal of vaccinating 75%. We are 86% of the way there, 86.7% of the way there with first doses, 63.8% of the way there with second doses, or with fully vaccinated, I should say. The population and goal population numbers will change. Once we open up to 12 to 15-year-olds, we will add those eligible folks into our calculation. And so you could wake up tomorrow and see these numbers dip a little bit. And the reason for that is just because we have increased the eligible population once 12 to 15-year-olds are eligible. But again, you see 3.2 million doses administered, and we feel very confident about where we're going there. Next chart, this is what I was alluding to earlier, that case rate. You know, we've had some days, yesterday was 125. We've certainly had some days down. But again, 94, you got to go all the way back to May 31st of last year, a day that we reported 73 cases. You have to go all the way back to this month a year ago for a single day, any day, when our case count was under 100. And the day-to-day numbers, as we've often said, are not important. They go up and down a little bit. But I think what you see here is our percentage of positive low, our case rate low, and generally positive news overall about what we're doing. The next chart here, again, we're just showing the totals for what was actually received. You can see right there this week, 302,000, so up 50,000 from last week. Still not an all-time high. That happened a little bit earlier this month, but we have plenty of vaccine to be able to meet the need, and we think next week's totals will be even higher than what we have now. So we just want the public to know there are vaccines available. If you haven't gotten in now, please do. We want to continue our progress towards getting folks vaccinated. Next slide here is an update on some mobile sites, and this is also available on our website. And this is a listing of dates along with community locations. You can see markets, senior centers, partnerships with the Catholic Church and other religious institutions, community groups, businesses, the consulate, community colleges, libraries. Again, we're doing everything we can to get out into the community and set up mobile vaccination sites where folks can drop in and get their shots. Again, to reiterate, if you have a 12 to 15-year-old, please do not show up at one of the mobile sites. We cannot guarantee there will be Pfizer available. The mobile sites are primarily using J&J vaccines. Makes it a little bit easier to not have to come back to the same mobile site 21 or 28 days later. But Pfizer will be available at all of our static locations throughout the county, and we encourage folks to go to our website. And a number of folks will just go to your healthcare provider. You can always reach out to your pediatrician or your healthcare provider, and once they are approved, they will be eligible as well. And then the final chart here is just our weekly thing. And again, you can see our case rate had a pretty significant drop there from 5.0, our adjusted case rate last week, down to 3.7. And so we think this is a good testament. Again, as we talked about last week, probably not likely we get into the yellow tier before June 15th. Certainly could happen, but I think unlikely. We'd have to continue descending at the rate we did, and we're probably going to run into June 15th before we would get to that point. But we are encouraged to see our case count descending, our unadjusted rate lower, our adjusted rate lower, our testing positivity percentage lower, and our health equity testing positivity percentage lower as well. And so we think this represents continued progress. With that, let me turn it over to Vice Chair Vargas, and then we will take your questions. Both Dr. Wooten and Dr. Shaw are on hand to answer any questions you may have.
Thank you, Chair Fletcher. Each week we're gaining ground, and it's due to the great effort from everyone on this campaign and those in our community that have worked together from the beginning. As Chair Fletcher mentioned, we're very excited about the possibility of expanding our vaccination efforts so that 12 and 15-year-olds can receive the vaccine. This opportunity for this youngest demographic is a huge step in the right direction, particularly in communities where we know COVID has impacted the most. It's going to allow us to get closer to a full reopening for our communities and reopening our community. I'm also really happy to see that we're working with our neighbors to the south to find ways to protect those workers in U.S.-owned companies that are part of our binational community. An equitable distribution of the vaccines have been our sole focus, and now because of the great progress we've made, we're able to focus on these sectors of our community. Soon, hundreds of employees that work in the U.S.-owned companies across the border will be able to receive their vaccine as well. So we're looking forward to this work. We're going to continue to urge everyone that has not received their vaccine to please head on to one of our vaccination sites and get that first dose. Again, I want to thank everyone for working on the front lines on this effort, and to everyone in the community doing their part to make sure we fully recover from this pandemic. Cada semana estamos más cerca al regreso a la normalidad, y eso es prueba de que cada paso lo hemos dado juntos y así lograremos nuestra meta. Como mencionó el presidente Fletcher, pronto abriremos el proceso de vacunación para los jóvenes de 12 a 15 años de edad que ya van a poder acudir a recibir su vacuna. Para esto estaremos administrando la vacuna Pfizer, que está aprobada por la CDC para jóvenes de esta edad. Esto va a concluir hoy por la noche. El otro comité del oeste, ellos van a tener la última aprobación, y ya creemos que para mañana en la mañana ya la tendremos. Así que es importante porque los jóvenes van a ocupar el consentimiento de sus padres o las personas que los cuidan, una identificación que tengan los jóvenes también, y si sus padres van con ellos no es necesidad que tengan identificación. Lo importante aquí es que el hecho que podamos extender nuestra campaña de vacunación para incluir a jóvenes es prueba de que cada vez estamos más cerca de una reapertura completa. Por otro lado, seguimos trabajando juntos para resolver algunos de los retos también que tenemos a nivel binacional. Estamos dirigiendo nuestros recursos para que los empleados de las empresas maquiladoras estadounidenses en la frontera también tengan acceso a la vacuna y estén protegidos. Con el aval del gobierno federal y del condado podremos vacunar a cientos de trabajadores de maquiladoras en Tijuana de empresas estadounidenses. De esta manera, damos también un paso a una recuperación binacional que, como sabemos, favorece a la economía y salud de ambos lados de la frontera. Quiero seguir invitando a todos aquellos de ustedes que no han recibido su vacuna, que por favor acudan a uno de nuestros centros de la comunidad. Debemos seguir protegiéndonos para poder regresar a la normalidad. Estamos cada vez más cerca, pero no debemos de bajar la guardia y debemos seguir los lineamientos del Departamento de Salud hasta que se levanten las restricciones próximamente. Una vez más, gracias a todos nuestros equipos de trabajo que día a día hacen todo lo posible para hacer este objetivo realidad. Gracias.
All right, we'll now go to our call-in questions.
This first call is from Laura Acevedo with ABC 10 News.
Hello, everyone. Thank you for taking my question. Earlier today, the governor said that life after June 15 is going to look very much like it used to pre-pandemic, including not wearing masks except in large indoor spaces. So I was wondering if San Diego County plans to follow that when we hit the June 15 mark of not requiring masks.
Yeah, we have generally very consistently followed state guidance, and I think that would certainly be the case in this instance, but let me have Dr. Wooten weigh in on that as well.
Thank you for that question. And the news today certainly does give our entire state hope, but we still have to look at, from jurisdiction to jurisdiction, what the case rate is, and that will determine exactly what we do. There's nothing magic about June 15th in terms of where all of our jurisdictions will be as it relates to the case rate, but to as much as the extent as possible, we will follow the state guidelines, but it will also have to depend on what our local case rates are.
Next question.
This next question is from Jonathan Wozen with the San Diego Union Tribune.
Hi, thank you for taking my questions. Couple vaccine-related questions here. Just want to make sure I'm understanding how things might work as soon as Thursday, as soon as tomorrow for those 12 through 15. So in terms of the appointment piece of things, will kids in that range be able to kind of book their own appointments? Will that have to be done through a parent or guardian? Looks like My Turn just yet doesn't have an option for children below the age of 16. I know you mentioned that kids or children will be able to come to the static, stable, fixed county sites with a parent or guardian. Is there any plan from county health to bring vaccine clinics to schools? I know some of the health systems are doing that, and I know there's that recently announced program to, for the county to set up kind of pop-up vaccine clinics at businesses and nonprofits and other organizations. Will schools be on that list? And then just a messaging question, just curious to know how the county is going to basically make the case to, a much younger audience to get vaccinated, right? These are folks that don't tune into the weekly pressers, that get information in very different ways. And, some of them may want to get vaccinated, but may have a parent who is not, inclined to consent to that. So how are you going to deal with that and maybe make the case to parents that they should let their kids get vaccinated?
All right, thank you, Jonathan. So My Turn will be updated once the vaccine is actually approved in California to have the consent. The parental consent will be built into the My Turn appointment system. It's not updated yet because the appointments are not being scheduled yet because the final approval hasn't happened, but it's been conveyed to us that My Turn will have the parental consent as a function or feature of the appointment process when you're making it. And so I think you should see that come online and be done once it's approved and people are able to actually make appointments. The second thing is we are working with a number of schools. A number of health systems are working directly with schools. We're working with schools to do everything we can to try and facilitate that, and we will certainly expand on that and do more. The third question you had in terms of making the case, I think what we're likely to see is if you look at the 65% of San Diegans that have already received a first dose, it's highly likely that the vast majority of those folks will want their 12 to 15-year-olds to get vaccinated as well. Out of our 5 kids, one of them is in the 12 to 15-year range, and we're eager to make his appointment so he can go in and get vaccinated once it's official and approved. And so I think we'll see an initial rush of 12 to 15-year-olds. Their parents will help arrange and get them in to do it. And then to your point, we're going to have to settle into that kind of ongoing work to engage parents and engage youth to be able to do it. Now, you do need a parental consent if you are to get it, and so it is going to be a thing of communicating and messaging to youth the importance of it, but also communicating to parents the importance of having your kids get vaccinated and why that is important. We have been doing a lot of work really targeting that kind of 18 to 24, 26-year-old who can make their own independent decision that this is what they want to do. And we will work to do similar messaging around engaging parents about why it is important to get 12 to 15-year-olds vaccinated. But again, it does require parental consent. And that's just the structure of the vaccine system in California. And so we're going to do everything we possibly can to get as many people vaccinated following that structure.
Thank you.
This call is from Brandon Lewis with CBS 8.
Thank you for taking your questions. Wanted to follow up on the mask question. Could Dr. Wooten share some of the discussions that took place with public health officers ahead of this announcement? Were they all on board? What concerns or reasons for support were expressed, given that we're a month out? And we've heard all pandemic long how important masks are at stopping the spread of the virus.
Well, I'm going to disappoint you because there was not a lot of discussions about this particular announcement that was made today. So that's all I have for you. We've had a lot of discussions about masks, but this was a new revelation, at least for me. And I've been on many of the calls, so thank you.
Are you in support then?
Pardon?
Are you in support?
I have to go back and look at the specific guidance. This was just announced right before coming over here, so I need to go back and look at the specific guidance. But as has been stated, the governor did announce that, but this is as of June 15th. And as I stated earlier, every jurisdiction is different. So unless we have case rates that are much lower than, definitely less than 2, we will have to examine whether or not we will follow through with that recommendation. But again, it depends on what our case rate is going to be.
Thank you, Dr. Wooten.
And Brandon, I think just to follow up on that, I think June 15th has been put out there as a date where we begin to return to normal. Obviously, other than really large gatherings, really high risk where there's tremendous mixing of folks who may be unvaccinated, June 15th, the retiring of the tiers, is a significant date, and I think, you know, a lot of the thought process behind that is the vaccine is available. We have enough vaccine. We are still at a point today where we have plenty of appointments today. If you go and you get an appointment, you will have plenty of time to get your second dose before June 15th, and so once the vaccine is readily available and we are seeing significant utilization of it, there's significantly less threat to the healthcare system, and individuals have had the opportunity to get the protection of a vaccine. So obviously monitor it as we go forward. We'll get some more guidance from the state, but I think June 15th is a date a lot of folks are looking forward to. As a date, by that time, everyone who wanted to get vaccinated has had the opportunity and the availability to it, and that is the date we begin to move forward. But we'll obviously monitor between now and then what comes out from the state, along with looking at all of the relevant data and issues surrounding transmissibility of the virus and what's happening and where we are. But I think in general, it's encouraging that we can see a light at the end of the tunnel and continued forward progress.
Thank you, Supervisor.
Next question.
This question is from Melissa Adan with NBC7.
Hey there, good afternoon. So my question is for Supervisor Vargas about the efforts to vaccinate essential workers at the maquiladoras. Will this open it up to also vaccinate essential workers at other sectors? For instance, if you're a restaurant worker but work here in San Diego but then live in Tijuana, etc. And if possible, could you please answer this question first in English and then in Spanish for our viewers at Telemundo 20? Thank you.
Thank you for that question. Actually, if you are working in San Diego and you are already, if you're a restaurant, part of the restaurant industry, you should have already been able to receive that vaccine. Entonces es importante mencionar que no importa, esto no cambia nada, ¿verdad? Si trabajas en un restaurante o, por ejemplo, en cualquier industria que ahora vamos a abrir a las maquiladoras, este programa es diferente porque es específicamente para maquiladoras que están en el lado mexicano, ¿verdad? Entonces es importante mencionarlo. Sabemos que hay muchas personas que viven, que no viven en San Diego, pero que trabajan en San Diego y que tienen residencia en San Diego que pueden recibir la vacuna también. Gracias.
And thank you. And Supervisor Vargas, to clarify and also answer the question in English, at this point, I've been to vaccination sites where folks are asked to show either a proof of residence. So at this point, would any essential worker then be able to say, despite me not having an address in San Diego County, I can get my vaccine here in this county?
Yes.
Excellent. Thank you.
One quick thing, Jonathan, if you're still on the line, I did just confirm for you, we are willing to roll mobile sites with Pfizer vaccines to schools to partner with schools. And so we have that capability, and we'll work with schools to make that option available. Next question.
This last question is from Alexandra Rangel with KPBS.
Hi, thank you so much for getting to me. My question is, what are your thoughts on the recent positive cases with some of the Padres players? And are you guys worried or monitoring a possible outbreak on the team?
Yeah, we've never discussed individual cases, and we're not going to start that now. So we encourage everyone out there to get vaccinated, be careful, and for any comment as it relates to the Padres situation, we'd have to refer you to the Padres. We'll go to our text questions.
So this first question is from Mario Sevilla with ABC 10 News. Where is the county in their plan on vaccinating homebound citizens? Please provide an update on the number of people on the wait list and timelines for giving them the vaccine.
Yeah, thank you, Mario. So we're presently at about what we have at 711 homebound seniors who have been vaccinated. We have a wait list that is considerably large, 1,947. However, it's very important, Mario, you realize we are having a great challenge getting return calls from a significant number of those folks, and what we're anecdotally being told is a lot of them managed to get vaccinated from another site or location, and so we don't think that there are 1,900 folks out there who are homebound who have not been vaccinated, but everyone that we're able to get a hold of, we're getting them in the queue with our service providers and getting those taken care of.
This next set of questions is from Claudia Bucio with Univision San Diego, and she's requesting the first two answers in Spanish from Supervisor Vargas. What documents will parents need to present to give consent for vaccines for teens 12 to 15? Do they have to be physically present? The second question is, what is the distribution strategy to target 12 to 15-year-olds who are struggling with vaccine hesitancy? Will walk-ins be an option?
Sí, la pregunta es específicamente la idea de cómo van a poder tener acceso a las vacunas las personas de menores de edad de 12 a 15 años. Entonces es importante informarle a los televidentes que van a ocupar el consentimiento de sus padres y hay una forma que pueden tener. El padre sí se le pide que vaya la persona con el hijo a acompañarlos a las citas, ya sea un padre o el adulto que es el que los cuida, ¿verdad? Cualquier documentación que traigan, ya sea su licencia de manejar o el permiso, ¿verdad?, para manejar, pasaporte o cualquier otra identificación de las escuelas. En cuanto al acceso a las vacunas y los jóvenes que tengan o no tengan esa habilidad de poder tener acceso a la vacuna, vamos a tener proyectos con las escuelas en particular para que puedan tener el acceso a la vacuna. Entonces ya estamos colaborando con los distritos escolares para poder tener esa oportunidad de vacunar. Ya hemos hecho este proyecto de los proyectos móviles en ciertas escuelas en el condado del sur de San Diego, específicamente como programas pilotos, y esos programas los vamos a usar en otras escuelas por todo el condado también. Gracias.
And the next set of questions is still from Claudia, and she wants to have them in English from our doctors. The first one is, what message do you have for parents, especially among hardest hit communities who are unsure about vaccinating their children 12 to 15-year-old? I'll repeat the question. What messages do you have for parents, especially among the hardest hit communities, who are unsure about vaccinating their children 12 to 15-year-old?
Yeah, thank you for that. This is an opportunity to emphasize the fact that the vaccines, the actual Pfizer vaccine, that's the only one that currently is approved or will be approved, we are anticipating after today, will be approved for the 12 to 15 years of age. And they are also approved for 16 years of age and older. Again, the same vaccine can be used in both of these age groups, and it is safe and effective. So I encourage parents to seriously consider getting their children vaccinated, and if you're not vaccinated, to get vaccinated yourself. These vaccines do help to save lives, prevent hospitalizations, and prevent deaths. So they are highly effective. Thank you.
Dr. Wooten, she had a follow-up question. Will the county receive a shipment specifically for teens, or is it the same for adults but in smaller doses?
Yes, I actually stated that in my comment, but it's the same dose. A smaller dose will be required most likely for the 6-month to 11-year-old population, but we aren't there yet. For the teens, 12 to 15, the vaccine is exactly the same for the 16 and over. Thank you.
All right, that concludes our questions for today. We thank everyone for joining us. We'll be back with you next week.